disasters, and certainly rang true for us in Rochester. This is our skyline in Rochester, New York, where our air quality is generally quite good. But due to wildfires from Canada, our entire area was blanketed in thick smoke during last year's wildfires. As has been reviewed in other talks, the climate has been changing quite rapidly for many years. As we see here into the 1920s, global temperatures, the red indicates temperatures 2 degrees Celsius over the industrial average. And we see as it gets to the 1980s and 1990s here, in America and India, we're having increases in global temperatures until 2024, which was the hottest year on record. And so we're very concerned about these increased temperatures, and we need to try to understand what effect that may have on respiratory diseases. Using an extreme event attribution score, this Nature Communication paper did a nice job outlining some of the cost of the threats. So you see the threats to respiratory health here, the hurricanes, dust storms, heat stress, wildfires, even naturally occurring things like volcanoes and earthquakes can be exacerbated by climate change. But over 20 years, roughly 70,000 human deaths have been attributed directly to the human contribution to climate change, and estimated to cost the world about $16 million an hour. And 64% of the storms, like hurricanes, are the predominant storm. Oh, yes, sir.
Just actually, I think you shared your secondary screen. Could you share primary screen?
Oh, absolutely. I wondered if that could cause problems. Actually, let me just bring this. Now, how about that?
Yeah, now it's perfect.
Now it's perfect. Okay, thank you. Yep, thanks for pointing that out. And so okay. Oh, I just have to. Oh, I see. Um, okay. Oh, apologies. Let me. Now, are we still with me here? Are you able to see the screen?
Yes, sir. Yes, sir.
Oh, okay. Let's get that back up. Okay. So now, let me get that back up. Okay, so as I mentioned, climate change is incredibly expensive for the world, and unfortunately, all these are severe underestimates. And is there no data from heat-related deaths from sub-Saharan Africa, for example? Now, the next slide shows all the different range of health effects and health system effects from climate change. We have heat-related illness. We have on the top line, the health effects, the trauma, the mental health stress, pulmonary disease, infection risk, which we'll talk about, malnutrition, and of course, migration related to climate change. Now, health systems are under stress too. Trying to keep our patients safe in the hospital during heat waves is difficult. Maintaining indoor air quality, the risk to health staff themselves, and damage to the infrastructure. Now, the social determinants of health, we've certainly appreciated the housing damage, the equity issues, supply chains, and government destabilization, which can happen with climate change, puts health at risk. But then ecological determinants of health on the bottom line, with the extreme weather, biodiversity loss, global temperature rise, and sea level rise. Now, trying to put together the different factors that worsen climate change, we have many different industries. So As we know, energy is a big producer of carbon emissions and also other pollutants. So particulate matter, black carbon, and gaseous pollutants. And then agriculture, as we know, putting up methane, nitrogenous air pollution, urban effects of heating and cooling, putting out more emissions, and then natural sources, as we reviewed. And all those become secondary pollutants in the atmosphere as they mix with other chemicals and sunlight in the atmosphere. You get ozone and other modified particulate matter. And all these have pressure and create cumulative health impacts. And when we think about what's in the wildfire, what's in the different types of smoke, the gaseous pollution. One thing I want to emphasize that gaseous pollution is the same for all sources, whether it's coming out from a wildfire or tobacco, combustible cigarette or a tailpipe, the nitrogen dioxide, sulfur dioxide, carbon monoxide, CO2, it's all the same. No matter the source. However, particulate matter is complex and it's affected by combustion conditions and fuel. The high temperatures, these of industry, cars, stoves, that creates more black carbon, fewer VOCs, the volatile organic compounds, whereas lower temperature things like wildfires and incomplete combustion, like cigarettes, that's more of a brown carbon, more volatile organic production. And so when we think about the source of the pollution, that's an important potential risk factor for health. So let's put it all together where we think about the fossil fuels and the increased greenhouse gases we know lead to climate change. That puts stress on the second level, environmental changes. We see the wildfires, we see the precipitation patterns, the dust storms, increased temperature and heat waves. That then puts stress on the next level, which is worsens our air quality. And we get more storms, we get particulate matter, which we discussed, increased ozone, which is a greenhouse gas. Now, this ozone, as we've seen, feeds back into the top level, and you get worsened climate change related to that. And this top level then feeds right back to the third level about air quality, where that increased heat, the increase with climate change, has then leads to extended pollen seasons and increased mold. So you've got longer duration of these allergic exposures, which then lead to more allergic disease, atopy, asthma, but also modulate our immune system. That allergic exposure can increase the risk for respiratory infection, and also the pollution itself can independently increase the risk to infection. Now, when we think about that's just the pollution effect on the world and its risk for respiratory infection and disease, but this One Health planetary health framework helps us think about what our interactions are with the complex ecology of the world around us, including animals. Now, in the middle, to orient you, these human effects, anthropogenic drivers, include our fossil fuel use, deforestation, contact rates with animals in the world. These forces then put pressure on these outer rings. So now let's go to the first ring here, where the things that we do as humans then chain range shifts here with animals. Animals have to move to new areas, and that introduces new species to new areas, leading to spillover of diseases from those animals to humans, and changing the host behavior of the animals and ecosystem services, degrading water quality and putting us in contact more with the animals. Now that puts pressure then on this outer ring, leading to novel disease spread from animals to humans. And then as animals become sick, the species decline there leads to cascades through the ecosystem, which are exacerbated by deforestation and other and further degradation of water quality and air quality. So a very complex system here, but to put it very simply, what we do as humans here on the top accelerates global temperatures and leads to loss of biodiversity, crowding, and precipitates infectious disease outbreaks. To be specific, The outbreak that we're worried about in the United States right now is influenza H5N1 in at least 16 of our states. And the H5N1 is from wild birds, so ducks, waterfowls, those carry it onto poultry fields, which we use for eggs and meat. In the US, very reliant on that, but it has a terrible fatality rate within the chickens. That spreads to cows that are in nearby farming operations, and then ultimately to humans. Here, the human infection, so far we've only seen animal to human. We have not seen any human to human transmission. That's what you worry about for a pandemic, would be human to human. We have not seen that in the US or elsewhere, but we are taking care of danger because there's certainly danger in chicken, cow contact, avoiding raw milk. So when we think about air pollution and respiratory infection, the epidemiologic data is quite strong. It's been developing over the past decade. The number of studies have accelerated. We have some in the Western United States. In our medical center, we've been studying this air pollution and respiratory infection link. In China, they've studied it in large cohorts in the United States and elsewhere. We've had studies on this. And in India, a really nice study on air pollution and respiratory infections, talking about the dynamics. This is what I liked about this study is that it showed the air flows near the Himalayas, that unique geographic areas can have unique pressures from air pollution. So I'd like to talk about, how does this happen? How is air pollution and climate, how are they both linked to respiratory infections? Because it can be a complicated mechanism here. And so I want to emphasize that there's direct and indirect effects. So first, let's focus on air pollution. Air pollution, we have particulate matter, ozone, nitrogen dioxide that decreases macrophage phagocytosis. The surface antimicrobial peptides are driven down, increased proteases, which can injure the lung. Pollution can do that directly. But now let's look over at climate, where there are multiple effects. First, we have UV radiation coming in. Air pollution can actually block that, which would then theoretically decrease the synthesis of vitamin D, which is meant to be protective to respiratory infection. So with the that UV radiation can its helpful effect can actually be blocked by air pollution, and technically it has virucidal activity, but not enough to be that is not alone to say, sun shining is not going to save us from respiratory viral infections. High temperatures we reviewed, as the temperature of the world increases, that can create, while that technically is virucidal of something on a surface, that is creating an increase in the ability for the virus to spread. The relative humidity is an important point because that corresponds to high temperatures as well, where that increased humidity can help the survival. But even in cold temperatures, as we know, the cold temperatures, when the temperature is low and the humidity is low, that doesn't necessarily help us either, because the droplet size changes. The droplet size decreases. So when we cough and when someone's sick, the droplets can carry farther when the size is lower. And so that is an increased risk for spread. And then when it's cold, everyone huddling inside, increased contact there. Low temperatures also decrease the functioning of airway ciliated cells, and a change in temperature. When you have a very cold day followed by a very warm day, that actually can dysregulate our immune response and increase the risk for respiratory infection, and vice versa when you go from a very warm to cold day. So in summary here, we have a decreased immune respiratory defense, we have increased viral entry into the host cell, and an increase in the respiratory virus morbidity and mortality related to air pollution and climate change. Now, I wanted to point out that hot air in itself, so we talked about pollution, we talked about climate, but I wanted to dig into hot air a little bit more. There's a nice study a controlled study here exposing individuals to hyperventilate air that is 120 degrees Fahrenheit, so very warm air, about 49 degrees Celsius, for 4 minutes. And now let's look at their pulmonary function test. So the flow, liters per second on the y-axis, x-axis is volume in liters, and we see baseline and after room air normal temperature, pretty normal, right? These are individuals with asthma, so they're doing fine here. But then look at them after that hot air exposure, and look at that. Look at the decrease in the FEV1, the forced expiratory volume in 1 second during the exposure went from 3.44 down to 3.04, so almost 400 milliliter drop in their FEV1. Now they rescue them. They pre-treated then with ipratropium and normal baseline, but after the ipratropium, they were protected from this effect, but not after a placebo. So the punchline here is that this blunting of the bronchospasm by ipratropium, a muscarinic receptor antagonist, suggested a cholinergic reflex pathway related to hot air. Now, these C fibers, sensory nerves, are implicated in this, and also with hot air exposure, you have inflammation in the epithelium, which is a concern because that may increase the risk of respiratory infection and worsen symptoms. So you've got someone in a heat wave. Not only are they at a risk of bronchospasm, worsened symptoms, but they may also be at an increased risk of respiratory infection. So very important for them to be careful during that time and treat their symptoms with inhalers, especially ipratropium or a muscarinic receptor antagonist. Now, I wanted to dive down to the deepest level within our bodies of this inhaled pollutant exposure. And this is a summation, a nice review of in vivo, ex vivo exposure studies. And we start at the epithelium here in the top left. Particulate matter can irritate the epithelium, lead to inflammation and gaps in the epithelium, where you have an increased risk of viral and bacterial infection entry into the cell. I put heat there as well because we just reviewed heat could inflame these cells as well. And this applies to COVID and influenza, seasonal viruses. And so part of the thing that we worried about, remember in that prior slide, is viral activation and entry. The toll-like receptor activation is impaired as well, where it can't recognize the infection, impaired intracellular pathway activation, the gene expression is impaired. This is something I'm looking at with air pollution exposure and transcriptomics. And we have also impaired antiviral immune signaling as well. And then without that immune signaling, you don't get your effector cells. You don't get the macrophage function, the cytotoxic T cells, a net formation. So in a variety of different ways, we have impairment in the respiratory immune response. And as we know, the viral infections are an exacerbating factor to many diseases. So when someone, it's one of the major drivers of asthma exacerbations, COPD exacerbations, but even folks with fibrosis, ILD, pulmonary hypertension, increased pressure within the pulmonary circulation, we have exacerbation of all these different conditions from respiratory viral infections. So that it doesn't stop with the infection. You can have additional health concerns related to that. So now to try to counter this, these next steps in climate and respiratory infection research, we need to try to understand the this mechanism on this complex association, because the true interplay between heat and pollution is not perfectly understood. This data and research infrastructure in low and middle income countries is important because entire gaps where an entire continent in terms of Africa is not well characterized. We can't fully understand this problem. And this characterization of risks from compound events is important. Exposures to pollution within these temperature and humidity ranges, the interplay between temperature and humidity and respiratory infection is very complex. The One Health And ecosystem health is important, where we have to have a healthy ecosystem to protect us from the spillover events and related to animals spreading disease to humans and vice versa. Now, the final part here is something called an integrated cumulative health impact assessment, where you really try to understand holistically what's happening in a community. And the idea there is, could we act early warning models for communities, particularly marginalized communities that don't have the same resources as communities, as wealthier communities? Can we give them an early warning that either bad pollution or bad other climatic um, factors are coming into their area, and can we give them to try to mitigate those issues? So, in summary here, so we can get to any questions, these climate change and air pollution are in a worsening feedback. Capture that complexity of climate change on the air pollution exposure, and with One Health and planetary health approaches are needed to need to continue exploring those to understand that, and that air pollution and climate change can exacerbate respiratory infections directly and indirectly. Figure out the mechanism and the timing of these effects to better understand the problem. And ultimately, I think the key, when we think about, well, what can we do to change everything, or to mitigate this risk, is truly trying to shift, burning fossil fuels, our massive agriculture operations, things that really emit CO2 and methane, that increase climate change. These are the things that we need to try to manage. We need to try to use renewables when economically feasible. We need to try to just burn less, consume less. In the United States, food waste is a big issue, which we need to work on, and other individual actions here to try to reduce and reuse. But with that, and I thank you for allowing me to join you virtually today, trying to decrease the flights and with the schedule. But thank you very much for your attention, and please let me know if there are questions. Oh, I think the main microphone is muted. If
Request any of the delegates, if they have any questions, please come to the podium.
Dr. Daniel, can you hear me?
yes, sir.
I'm,
I
I'm,
can
I'm,
hear you.
I'm, I'm Dr. Rakesh. I'm part of NIOHR. I have a question that we've been speaking about the respiratory effects because of exposure to various climate parameters, including air pollution, temperature, and relative humidity. And you did suggest that some of these interventions, such as burn less, would probably potentially reduce it. Are these hypothetical, or are there any proven models? For instance, we did have a period of COVID when there were very fewer air pollution concentrations, in fact, reduced in a lot of Indian cities. So during such periods, or during such anecdotal models, are there any evidences to document that, yes, in fact, if we follow these interventions or these models, we'll be benefited by reducing respiratory burden or other overall disease burden? I mean, are there any examples or any such things? Thank you.
Yeah, that's an excellent question, and we saw that as well in the U.S. cities, in New York City and other areas. We had a dramatic reduction in nitrogen dioxide exposure related to decreased industrial activities. And so, yes, the pollution absolutely came down during COVID. Unfortunately, in the U.S. at least, it came right back. After months, we had things had shut down for several months, but the pollution came right back to the same levels. And during that time, as you probably experienced as well, life changed dramatically. People were inside. People were trying to avoid contact with individuals who were ill, and so that really complicated our ability to understand that effect. Because hypothetically, we could, with all the studies that we have, we can intuit that yes, the risk in theory was lower related to air pollution, but the risk of infection to a highly pathogenic virus like COVID was much greater. So unfortunately, it was washed out. And that's the difficulty with COVID, where in a way you have to put it in a different categories. All the behavioral changes, societal changes make it incredibly difficult to study from an epidemiologic approach. So intuitively, everything we know, we'd have to say yes, but in terms of is there a study that says yes, absolutely things went down? I have not seen one that is able to account for all the COVID pandemic dynamics.
Thank you, Dr. Croft. I have a question for you. So I have been working in occupational health, particularly with cardiovascular illness. So my question stems from there. But since you're a respiratory expert, so I'm going to put it in touch with respiratory physician related question. So first of all, thank you very much. I enjoyed your talk. Right from the haunting quote, you hooked me towards the whole talk. So my question to you is, in terms of climate change and respiratory carcinomas, where are we heading towards understanding these both? And also as a follow-up question, I would want to know, how would we tease apart other multifactorial things in terms of lung carcinomas when we study climate change and respiratory health? I'm particularly curious because this is the same question I face for cardiovascular illness, which is also multifactorial.
So excellent question. The air pollution and lung cancer, respiratory carcinomas, that is a growing area of research as we understand more about the harmful effects of air pollution. When we think about the core stress from air pollution, you're thinking about oxidative stress, inflammation, and cell damage. And so that cell damage is what we worry about with carcinomas. So certainly there does appear to be an increased risk there between air pollution and lung cancer. But you mentioned multifactorial. You asked, well, how do we account for that? In the U.S. and around the world, smoking is a big issue. So trying to control when you have someone in a heavily polluted area with traffic pollution and other pollution, but you have high smoking rates, it's difficult to try to attribute, well, what proportion of that risk was from the air pollution versus the smoking. And that's why I wanted to show that slide where I like, the air pollution experts that have mentored me and, historically have said we need to think about air pollution, all air pollution kind of together. We need to not say, oh, well, this is the tobacco type pollution. This is the wildfire pollution. This is the smokestack pollution. You have to look that as I mentioned, all the gaseous pollution is the same. The particulate pollution, there are categories. Try to lump them together, and you say, okay, well, that cigarette exposure is somewhat similar to a wildfire exposure or kind of a wood stove exposure, and put biomass burning in there. But I think we can group them and try to understand that, okay, well, this is the characteristics of this type of exposure, so that we don't get into a siloed thinking, oh, well, that car that passed by their house, that's the one solution. As we know, it's much more complicated than that. But yeah, I wish there was a clear answer to your question about how to partition, these multifactorial issues. But as your interest in cardiac disease, the air pollution and cardiac disease link is very strong. Air pollution and respiratory infection disease is quite strong. That's growing. The cancer risk, that's coming too, though. That's kind of a next area of study.
Thank you very much.
You're welcome.
Thank you, sir, for addressing this important discussion.
All right.
As we are to the
Thank
end
you,
of the first day of our conference, I thank everybody for your participation, please. We shall meet again tomorrow, a few minutes prior to 9:30 a.m. for the next plenary sessions. Thank you.
Yeah. Thank you. Have a wonderful meeting, everyone.
Thank you, Dr. Daniel. And now we leave the meeting. Okay. Thank you. Thank you again.
Thank you.